Yes, as a biological dentist, is there anything I should look for intraorally or people can look for?
Why is there so much variation between what doctors recommend and you are initially diagnosed? Some say, oh, we can avoid sleep within 6 hours. Some say, oh, just take one pill of Oxy. Some say 2. Why is there so much variation in what you should do? Like people like you who are considered very
Let's talk about that. That's a good topic. First of all, I see a lot of people who, weren't diagnosed like we did earlier. I had an ear rash and went on 10 days of antibiotics. So I think that's a really good point. Starting at the bite, 50% of people or more don't even know they have a bite. 50% of them don't have ear rash. But there's an article that came out that said that 200 milligrams would prevent Lyme. I think it's 4 or 5 days.
In Westchester Medical Center, there was a chief of rheumatology who in 2001 went down to the emergency room. And considers himself an expert in Lyme disease. And he told all the emergency room physicians for the next 2 months, anyone who walks in with a tick bite or a tick is to be given a shot of doxycycline and 200 milligrams to take home the next day. What happened was about 2 months later, after this had gone on, he got the phone numbers and contacted all of these 100-odd patients. All of them felt better. No physicals, no exams, no lab tests. He then wrote a letter to the editor of the New England Journal of Medicine. It's in the October 2002 issue. It's in the back of the book. This is not a study. But what it did give the emergency room physician is something he can now use when a patient walks in, instead of saying to them, after they've sat there for 3 or 4 hours, hey, we're going to give you a shot of doxycycline, you can take these 2 home and you're going to be fine. The part that's being fine has never been studied. Okay? So understand that it gives the emergency room guy who's under the gun, because I don't know if any of you visit emergency rooms on a regular basis. If you go there and you spend a couple of hours because you're not the worst of the pain. Okay? And you don't want to walk out of there with a guy saying, tapping you on the back after 4 hours saying, don't worry, go home. If you feel bad, go see your primary in 2 weeks. You want it to do something, because the administration from that hospital is going to send you a little survey. And they're going to say, how did you like what we did to you while you were in the emergency room? If we kept you there for 4 hours and you didn't do anything, that's not going to be a nice note going back. So the physician did something. Is it prophylactic? Does it work? We don't know. Okay? There is no study ever done to prove that data. Okay? So that's where the 200 milligrams stands. Okay?
And I think it's also important that when you contact the patient at that point, that you find out, how long the tick has been on. Because what happens is the tick has to latch on. It has to bite, it has to suck up blood, it has to go into its GI tract with the bacteria, and it has to inoculate. So it depends on the time. The longer time, it also depends on the area. And so I think the other thing with emergency docs, they take that, and their knowledge of Lyme may be limited. So what happens is someone walks in with an EM rash, and I've seen them give 200 milligrams for an EM rash. EM rash is documented Lyme. I don't treat an EM rash for less than 6 weeks. But, again, ID docs can sometimes say 10 to 14 days with an EM rash, but I've seen so many people that have been treated like that. They come back, 6 months, a year. Oh, I had EM rash, I was treated, and then they came down with Lyme, or it was diagnosed in other ways like arthritis or headaches by a neurologist. So it's really important to know the whole physiology of what happens with the bite, the timing, EM rash, diagnosis of Lyme disease. That's really important. Okay, next, and then. Oh, preventative immunization. So first of all, there was an immunization that came out now. I think it was 8 to 10 years ago. At the Lyme conference when they brought up immunization, and infectious disease docs tested in their office. They were all gung ho. They got paid a lot of money from the drug companies. And at the same time that that was being tested, the micro guys in the other hall would come in and say, you know, there's something going on here. When we inoculated panthers and guinea pigs, and they came down with another species of Borrelia, which is, you know, the spirochete, they developed autoimmune arthritis. You know, so right then and there, 10 of us just, I don't trust this vaccine, so I never did it. And then gradually you started hearing people would get fatigue, immune problems, and arthritis from the vaccine. And then they said it got pulled because it wasn't used a lot. I think that a lot of class action suits were turning up.
He is absolutely right. What happened was Lyme was the pharmaceutical company that got the vaccine to the market. It was called the Lyme vaccine. When they got theirs, there was another company called Biomaru, another billion-dollar pharmaceutical was developed and wanted to clear for us the site. What happens is the vaccine was pushed through the FDA. It moved quickly. It was being pushed by well-meaning people and then a competition between two huge pharmaceutical companies. Those of you who got the vaccine know it took 3 shots. First shot was supposed to give you 60% sensitivity and protection. Second was bringing it up to 80. Third was going to bring it up to 95 to 100%. But they didn't know if it was going to be absolute. So that's why they told them, well, we might have to get booster shots years down the road. Before all that happened, a number of people came back, and I'll show you my slides. What happened was they came down with what was appeared to be Lyme arthritis, which is a severe arthritic pain moving around the body. And when they went back and they got the vaccine, well, a number of them, if you follow the package insert for the vaccine, it said you're supposed to do a lab test by a company at the time, it's called MedBat, it's now Quest. You're supposed to do an ELISA test before you give this vaccine, because it's what's called a whole cell lysate, which means it's an active bug, and you don't want to give it to somebody with the active infection. So you're supposed to have gotten the test all ready to see if you had the disease. Because if you already had the disease, no way you should get this vaccine. Well, as I'll show you in my slides later, the vaccine, the lab tests, we failed you miserably in lab medicine. And ELISA assays back in the 90s and the 200s, even now, they're just horrible. They're not going to pick up 50 or 60% of the cases. So what happened was a number of people that already had the test, like the insert said, came back negative, and then they got the shots. And all of a sudden, a number of them came down with Lyme arthritis. They went back, and now Lyme had no leg to stand on. Because they had people who had negative lab tests, just like their insert said, and then they came down with Lyme arthritis. So the class action suit, which made a number of lawyers rich and about 115 people sick for a long, long time after, required the removal of, the settlement was out of court, and it was the removal of the vaccine from the market. And since that time, we aren't seeing any research being done here in the United States for one. There is one being developed in Spain. Will it ever get here? No, you have to talk to the lawyers. Because, remember, 74% of all lawyers in the world live in this country. And pharmaceutical companies only fear one thing, lawsuits. Okay, so it could be a while. Sorry.
Okay, so first question, EM sensitivity, and also other immune problems, allergies and stuff like that. Definitely after Lyme, you definitely have immune problems. You either have an upregulated immune system or a downregulated. You can react to a lot of things, you can overact, or autoimmune allergies. And EM sensitivity, even outside the Lyme community, is becoming more and more of a problem. We are inundated by, in the field. So in a lot of the conferences over the last few years I'm going to, I'm hearing more and more problems that people are having with, homes, stations outside their house, cell phones and stuff like that. So I think everybody has to be aware of electrical sensitivity. Probably you with the Lyme, it's worse in your particular